The Health Secretary says that unions are making a conscious decision to put patients at risk. Is that what's happening?
Good morning. No, I actually think that's a really insulting statement to our key NHS and ambulance workers. They've not made a conscious decision to put lives at risk. They've made a conscious decision to stand up for what they believe is an NHS that is crumbling beneath their feet. And as they're watching thousands of their colleagues leave the service every year because of poor pay and poor working conditions and a feeling of being unable to deliver the safe standards of patient care that they want to. That's why they're making this conscious decision, and it is insulting to say that they're doing this to put people at risk.
And as you will have heard, the Health Secretary said that hundreds of millions have been invested in the NHS to try and solve the backlog. He's saying that should be enough and that striking workers really need to get back to work.
Well, we have to understand why there's such a significant backlog. And one of the crucial reasons for that is the 133,000 staffing vacancies that there are across the NHS. There are literally not enough staff working in the NHS to deliver on those services. And without an investment now in the workforce that we have got now, recruitment initiatives are pointless. We need to do everything we can to protect our NHS workers that are working in the system right now, and that could be anyone from porters and patient transport services to paramedics to nurses. We need to invest in this workforce now.
Now, the GMB, as I understand it, Rachel Harrison, haven't put forward a pay demand. Why is that?
Well, what we asked for when we entered into the pay review body process in good faith earlier this year was a significant increase in pay, plus a commitment and a credible plan to restore a decade of lost earnings and an immediate down payment on that. So that's what we were asking for, and that is what we would still like to see. But what we're saying to the Secretary of State and to this government right now is come to the table, talk to GMB, talk to the other health unions and make us an offer on pay that we can take back to our members.
I mean, as you will have heard, the Secretary of State is unwilling to talk about pay. So does that mean these strikes are just going to go on?
Our members are the ones that will decide what any future action may look like. But it's in the Secretary of State's hands to end this dispute now. And by this government refusing to speak to the unions about pay, it is them that are choosing that this dispute will continue.
Just a last thought from you, Rachel, if you can. How much longer on the mandate from this first vote have your members got for the strike action? When do you have to go back to them?
Under the trade union legislations that are currently in place, unions have 6 months from securing a ballot result for action to take action. If the dispute continues longer than that, we have to run another ballot.
OK. Rachel Harrison from the GMB, appreciate your time this morning. Thank you.
Thank you.